Let's go.
Welcome to the Integrative Edge, your go-to podcast for fresh perspectives on holistic health and functional movement. Join us as we explore innovative ways to optimize your health naturally and sustainably.
I'm Kelly Demers, founder of the Integrative Wellness Coalition and the owner of True North Performance.
I'm Lindsay Seefeld, doctor of physical therapy and owner and operator of Uplifted Oncology Rehab.
I'm Dr. Kimberly Klimek, licensed pharmacist and owner of Innate Healing and Performance.
You can find the show on Spotify, Apple Podcasts, or wherever you get your podcasts. Subscribe so you never miss an episode.
Welcome back to the Integrative Edge, your podcast where we explore innovative ways to optimize your health naturally and sustainably. I am your host, Kelly Demers, and as always, I am joined by my two amazing co-hosts, Dr. Lindsay Seefeld and Dr. Kim Klimek. Today's topic is mold illness and mycotoxins, what everyone needs to know. So these are things that you may not see, you may not smell, but mold can significantly undermine the immune system, energy, and recovery. Today, we're going to uncover what you need to know about the invisible threat hiding in plain sight. So, Kim, welcome back. To start us off, what exactly are mycotoxins and why should listeners care about mold illness, even if things around them look really clean?
Yeah. So mold are like fungi. They're their own class and species. But mold illness is basically a chronic inflammatory response to mold exposure, and oftentimes, yes, that comes from water-damaged homes, water-damaged buildings, offices, can be in your bathrooms. But mycotoxins in particular are the byproduct. They're the toxin, it's the toxin released from mold. So just how bacteria release endotoxins, mold release their own toxins, and those toxins are called mycotoxins. And they're basically compounds released by certain species of mold that can disrupt our immune system, neurological function, hormonal systems, and even gut health and liver health.
Lindsay, in your work as a physical therapist, working with oncology and lymphedema patients, do you observe physical or like tissue level signs that might hint that mold-related inflammation or lymphatic congestion is it lurking?
Yeah, so when you have mold toxicity in your body, it definitely presents in your system. And some of the key things that, I have seen or I've heard, number one is just chronic fatigue. I think that's a big sign where, the body is just really overall fatigued. You really have no rhyme or reason why you're fatigued. The second thing is pain. You just have like this chronic pain that just does not have like a reason for it to be there either. And it can be in unusual areas as well in your body. Neurological symptoms, so people develop like poor coordination. Tremors sometimes occur, visual disturbances. Another one is orthostatic intolerance. So this is where the blood pressure can drop significantly and they'll start developing dizziness type spells. Cognitive complaints, so like brain fog, memory issues. And the other complaint is high sensitivities to smells and chemicals. So those are usually the key ones. If somebody has mold toxicity, that's how it'll present in the body.
Interesting. And you've actually had experience with this, Kim, correct?
Yeah, absolutely. We'll dive into that little story too, and just because it can give people hope, I feel like for
sure.
recovering from this. But I was like, just to piggyback off of some of those symptoms. Yeah, some other ones that are definitely like giving you kind of red flags that this might be going on in your body. First of all, I guess we should differentiate a little bit too because people like hear about Candida or like fungal overgrowth in your gut. So like mold exposure typically comes from environmental exposure. So like you're going to inhale or absorb those toxins. And that's why people are like, you don't necessarily actually have to be living in a home that's mold infested. It could be any type of exposure that you had when you were somewhere. Like if you're at a work, your work environment or something like that, where you're inhaling these spores. While yeast or fungal overgrowth like Candida albicans is, something that people hear commonly about, or Candida overgrowth in the gut is often internal and yes, generally located in the microbiome in the gut. However, both of them are connected because mycotoxins can definitely create a more favorable environment for Candida. Because I always tell people, like, yes, we all have Candida, but when it's an overgrowth, that's when it becomes a problem for people. Like we all kind of have definitely a certain level of these bacteria or fungi, which are good. They're good for us in a sense, but then when they become an overgrowth, that's when it becomes a problem. So then when you're thinking about those overlap of symptoms, a lot of people will have a little bit more bloating and gas. Like if they have sulfur smelling gas, that can be a really big indicator for like yeast overgrowth in the gut and overlapping. But yeah, what Lindsay said, just kind of a heightened chemical sensitivity. This is like definitely something a lot of my clients will say, like, they say things like, yeah, everything, just like, I can't do anything with like fragrances or scents. It will trigger me, or they'll get skin rashes, right? Like skin rashes, itching, hives. And then a big one if someone tells me is like, if they have chronic like sinus infections or congestion or just like chronic allergies, because the mold and the mycotoxins can affect almost any organ in the body. There's we'll dive into that a little bit later, but they have the mycotoxins, depending on what strains you have, they can have affinity for certain types of organs. So that's why people may experience brain fog. There's a mycotoxin called gliotoxin, which is very like neuroinflammatory, so it's going to heavily target like your brain. But mycotoxins in general, they're very like fat loving, so they're going to go to like fatty tissue sites too. And they can cross the blood-brain barrier so very easily. So yeah, you're going to experience some of those symptoms like brain fog, congestion, and then again, like recurrent sinus infections. And of course, there's like, it's the very classic ones. Like if you have chronic like toenail fungus or jock itch or like chronic UTIs and yeast infections, those are definitely like triggers for like Candida or fungal overgrowth in the body in general.
So if you start to see those things present, those symptoms are more prevalent, at what point, rather than jump into testing and things like that, is there something that people can do to mitigate mold exposure naturally? I mean, is there some things that they can take steps towards, like, hey, I do have a few of these. I wonder if this is related to mold. Is there something that they can do just naturally?
Yeah, for sure. Actually, one of the biggest indicators is like if you like feel really terrible throughout like the winter and the fall months, but then in the summer you feel really great. The sun is actually really great for like basically like kind of killing off mycotoxins and keeping them at bay in the body. So that was kind of a very noticeable symptom in my own particular health journey. And then another thing is sometimes I'll have people kind of trial, like I'll give them a couple antifungals for the gut, like one, like a antifungal, antimicrobial, or like a spore-based probiotic. That was something I kind of posted about on my Instagram, I think a little bit ago. But spore-based probiotics are actually more targeted towards yeast. So if you feel much better taking a spore-based probiotic, that could also be an indicator that there may be a component of potential Candida or mycotoxins going on. Those are like two little easy things to kind of to test or identify a little bit. But then reviewing your health history and actually for everything we just said here, symptom-wise, assessing your health history and be like, yes, do I have any of those things? Because just diving a little bit into my story was that I had no clue what the heck mycotoxins were or mold toxicity or Candida, nothing. I didn't know any of that kind of stuff. But I did grow up in a water-damaged home, so my parents' roof had a lot of water damage in it, and some of the way you might respond even to toxins in general can be based on genetics. So later on in life, I had learned, I have 3 other siblings, and I'm like, why the heck do none of them have like allergies and that kind of stuff all the time? I was a chronic allergy kid, like my mom would joke. She knew when I was awake in the morning because I would sneeze 20 times, like before I would get out of bed, like literally like 20 times. And then I was chronically taking like Zyrtec and Claritin and always had to have allergy medications. And I was very constipated as a little kid. And so those were all just like, when I look back on my health history, I'm like, oh yeah, all that stuff kind of makes sense now. And I had a lot of brain fog. But then when I went off to college, some of those symptoms got better, right? Because I removed myself from the environment. But at the time when I was in college, I was still exhibiting just IBS type symptoms, bloating, constipation, loose stools sometimes, and just that it stayed with me, right? Because at that time, then my body was kind of already infested with like Candida overgrowth and like mycotoxins. So that's what I always explain to people too, is like first and foremost is yes, to remove yourself from the potential source or the environment and figure that out. We can talk about some of those things in testing your home if you're worried about that. Most of the time I'd ask people to look and like, how do you feel? Air quality is poor indoors anyways, right? Like, but you got to really ask yourself, like, do you have like a air conditioning unit that's like infested with mold or something like that you're unaware of? The HVAC systems and stuff like that, that's a big one. So if you can physically feel a difference when you remove yourself from that environment, you may have been being exposed. Because if you feel better going somewhere else, then it's likely there's something kind of going on underneath.
How long do you have to be removed from that environment? Like if you go away for a weekend, if your home is the cause of these symptoms and I go to work for 8 hours, am I going to feel better if I go right back to home, or do I need to be in a situation like I went away for college and I was gone for 3 months before I realized things were getting better?
No, it could be pretty drastic. Like you could go away for a weekend and just be like, gosh, I felt way better when I was at, this retreat or something like that for the weekend. It's pretty kind of noticeable. If you're pretty sick and kind of infested with some of this stuff, I would say. Okay. At least for me, it was for sure.
At what point do you think you get testing, right? So I've done a couple of these things. I go away, I do feel a little better. I come back, I don't feel. At what point do you say, hey, I probably need to give Kim a call or go to my doctor to get tested for some of this stuff?
Yeah, I think if, we talk so much about like foundations here. Like if you're one of those people where you've been doing a lot of those foundations and like you're working on like bowel movements, you're working on sweating, lymphatic drainage, and balancing hormones and things like that, and then you still just kind of feel crummy all the time, that's just sort of like that. It's sometimes for me, it's like the last step in the piece of the puzzle where I've worked with some clients. We've done, sort of what I would say the fundationals. We do a full blood work panel, we do gut health restoration, we do hormone balancing, and then they still feel a little bit off or just not quite there. Then, I look at things a little bit and I'm like, okay, for me at that last step, it's sort of like, what's the toxin load? And then I start to look at things like mycotoxins, heavy metals, maybe environmental toxins and things like that.
Lindsay, from a movement perspective, building on what Kim just said, from a movement perspective, how does mold-related inflammation or lymphatic load manifest in someone's physicality or ability to move? I
mean, they are so related. This is like inflammation, story. So when somebody is exposed to mold and toxicity, it just gets stuck in your system. Everything gets very stagnant. You get very inflamed. It's starting to affect, like Kim said, like different spots in your body, like your gut, your liver. You'll start developing brain fog, like we talked about. So it's very important, obviously, to identify and then start doing the things to kind of help your body start detoxing those things. But a movement is key. So hands down, when I'm working with clients that have mold toxicity, we got to get that lymphatic system released and moving, especially the liver. I think the liver is so incredibly key because that is what helps filter everything. And if you have a lot of stagnicity in that liver, it just does not help move as well as the gut. So, I'm teaching patients, you've got to get moving. You've got to do such things as, the vibration plate, rebounding, sweating, You need to do some deep breathing to get that gut system moving. So not only the things that Kim had talked about, like doing the different supplements, but you got to get your body released and moving to help the body actually eliminate the toxins that are built up in your system.
Yeah, I would say this is like definitely one of the conditions where you're really going to need some good help in terms of the lifestyle changes, nutrition, and definitely some professional grade supplements in terms of helping get the body to release these things. Lindsay kind of hit a really important piece. One thing that's very, I would say, triggering to me again is going back to kind of liver health. And again, we've talked about this so much, is that generally when you start to get constipated, it's because your liver is getting kind of clogged up. And fun fact here is that mycotoxins, one of their mechanisms, again, any type of like bacteria, fungi, whatever, they want to keep you a host, right? Like you're a host to them. So they're going to try to, multiply and kind of take over the space, and not to scare you or anything like that. But it's like, that's just how organisms work. And mycotoxins in particular, they will kind of, for lack of a better word, they're going to gunk up your bile. So they're going to make it very sludgy and thick. So then what happens is you start to get constipated. When you're constipated, you are not releasing toxins or eliminating toxins, right? So that it all makes sense. So that's a really big trigger for me, is like when people tell me like they're really badly constipated, or, they just have to do a lot to get those bowel movements flowing. And then, I'm looking at health history. So it definitely kind of pops in my head about mycotoxins. First and foremost place I would still start with anybody, it would be to help them with the bowel movements first and get the bile flowing and thin the bile and stuff, because that's going to help them start to remove the toxins. The one interesting thing too, I forgot to say, is that if you feel like you're learning about hormone balance too, and you feel like you're trying to balance your hormones and you just like can't get them balanced, that's another big trigger, because like I said, mycotoxins will very much disrupt hormonal systems. And I have very direct evidence from some clients who are young clients and their hormones are just totally in the tank. I'm like, why is this 30-year-old, like they should still be making really good hormones and things like that. But they're constipated and they have no hormones, and like even if we try to help them with some natural hormone support, they may still not be getting better. That's another trigger for me, because I would say even when I've shared a lot of my story, my personal health journey with endometriosis, inflammatory condition, estrogen dominance, I still, even to this day, will say that what triggered that was exposure to mycotoxins and disrupted my whole hormonal system, and I was not able to eliminate estrogen because I was constipated all the time, because you need good liver health and good bowel movements to eliminate excess estrogen. So I ended up getting just severe inflammation, and then even when I would go to the OB-GYNs who were treating me for endo, they diagnosed me with something called like interstitial cystitis, because I had a lot of bladder pain and bladder burning and nerve pain. And again, now to this day, I'm like, oh, okay, well, what's the root cause of all that? Here I come to find out too, a different kind of mycotoxin, one called ochratoxin A, is a category for a mycotoxin. It has very high affinity for the kidneys and the bladder. And when I did my own mycotoxin testing, we talk about that. It's like a urine test. There's kind of two different ways, but it's a urine test. And yeah, sure enough, I had very sky-high levels of ochratoxin A in my body and gliotoxin. I think I had like 20 times the amount of gliotoxin. So it's funny, because when I was dating a guy in college, he would always like kind of make jokes that I didn't listen to him because I'd space out and have like these little moments where I couldn't remember anything he said literally like 2 minutes before. And he just kind of, he'd get upset, like, you don't listen to me. And I was like, no, I just had such bad brain fog in college. Like, I'm not even sure how I made it through like undergrad and stuff like that. But again, it's because I had these Candida overgrowth and the mycotoxins.
Sure. Lindsay, you had a story as well related to.
Yes. So I really wanted to share this because this is an actual client that I'm working with currently. therapy, and she had such profound mold toxicity that I felt that I needed to share this. It was with her and her son. So, listeners, take a listen to this, because some of the symptoms are real life. This is what she really was experiencing and her son was experiencing. And so, if you do hear this and it's like, wow, that sounds like it's me, or, hey, I have a friend, please share this episode because this is really profound. So this patient had known toxicities. So she went and got tested, and she's working with me currently right now to help get that toxicity eliminated in her body. So that's what we're currently working on. But so when she was exposed, so they discovered it was in her home, but she didn't know it at the time. So basically what she was telling me, this symptoms that she was experiencing was, number one, all mental health. She had severe anxiety, brain fog, and she says, she describes it like, I felt like I was on drugs the majority of the time. She couldn't lose any weight. She told me that mold exposure caused leptin resistance. And leptin resistance is a condition where the body's cells become less responsive to the hormone leptin, which normally signals for fullness and regulates energy balance. And so once she removed herself from this home environment, she lost 20 pounds really quickly because she had so much inflammation on board. The other symptoms that she had was she'd wake up drenched in the night. She'd have night sweats terribly, frequent needing to use the restroom. And then she describes that she got pretty bad dizzy spells and anxiety got really, really bad. And she says, it was like my eyes and the brain could not work together and I constantly felt off. And so that was her symptoms. Now her son was pretty profound. So her son was really little. Okay. So when he was first exposed, he was 2 years old. And so these are some of the symptoms that he started having. So at age 2, he stopped making eye contact and pacing a lot. He would have random laughter that didn't make any sense. And she says he had severe meat aversion. So this was due to the gut being so inflamed. And then he basically halted in his growth in his weight because he just didn't want to eat anything. And then he started developing a verbal tic and then clearing his throat frequently. So he's clearing his throat every few seconds. And she says this was a sign of serious brain inflammation. And then because of this mold attack, the strep had crossed the blood-brain barrier, and he had this permanent tic. And so this really signaled we need to do something. And so she definitely went and got tested, and basically both their scores were off the chart. And so she's like, okay, she's like, how do we fix this? How do we do this? And so, the two things that she did, she took, there was a home test called ERMI test. And so this is where you can test the different levels, I think, of your home to see what the mold sensitivity is. And then once she got that, she ended up hiring a company, and she told me that the most important thing is to try to find a company that is qualified. It's called the Institute of Inspection, Cleaning, and Restoration Certification. So she apparently went through different companies to test her home, but this was the one company that really did a good, thorough job in regards to really getting specific on where the mold was. And so they literally, she moved out of the house. They gutted the house. I mean, this apparently was a really old home, so there was a lot of mold toxicity and mold built up in it. And so, this is a process. She's been working through this for months trying to clear, when you're talking about being in an environment that's very mold toxic, I mean, it builds up in your system and it's not like it immediately clears out. So this is going to be a process for her. So not only is she working through it, but her son is really having to work with some specialists to also kind of clear that toxicity out of her body. So this is just a real life story that, this really can profoundly impact your health.
As you were talking, I remembered we had a client here that went through mold remediation services and had to do the same thing. House had to be pretty much stripped down, and yeah, interesting.
Yeah, I was going to say great, because I was going to say here's some of the ways you can potentially test your home, and Lindsay already mentioned the ERMI test. There's another one now that's it's definitely a little bit coming to the forefront. There's one called the dust test, and it basically utilizes mold specific quantitative PCR to identify the top 36 different species as well as toxins produced by both mold and bacteria, so that's kind of beneficial, that typically inhabit like unhealthy homes, depending upon the test that you select too on their website. But you can find that, and it's like anybody can just go purchase it, and it's definitely a cost-effective solution versus like instantly just having like a whole, the home inspections, they can definitely get pricey. But it's www.thedusttest.com. And I think it's like $250 or something. So pretty reasonable. And if you really want to, get a pretty, good test. And that's the environmental testing. But yeah, so, I don't know, did your client like bring in her testing for mycotoxins to you?
She did not, but basically she said she's working with a functional provider, and she's like, everything was just off the charts.
Yeah, like basically two of the ways that I've tested mycotoxins. So you can do mycotoxin testing generally through a urine sample or blood antibodies. So I'll list those kind of off here, but yeah, these are the labs used to detect those certain types of mycotoxins that we talked about. There's lots of different species. Some of the bigger ones are like ochratoxin, which is like, it's again more affinity for like bladder and kidneys. Aflatoxin is more toxic for the liver cells. Gliotoxin more for the brain, but there's more mycotoxins. But some of the ones that I use, the urine testing, I actually try to I tell clients to do like a provoked test too, like go in a sauna and sweat for about 20 minutes or so first, and then collect that urine sample. That's just kind of what I was taught through functional training, because the mycotoxins can hide in the various organs. So you kind of have to like provoke them to come out a little bit. Some trainings have said use like glutathione for like 5 days before, because that's a master detoxifier. So you're going to get some of those toxins to come out. So you can do that for like a week or so before, and then sweat for about 15, 20 minutes, or get a good sweat, and then collect that urine sample. And then that's going to give you like the most optimal or ideal reading for the mycotoxins, because you might not catch all those certain ones if they're kind of hiding in the organs, unless you kind of provoke them to come out a little bit. And then, so yeah, I use like mycotoxin urine testing from like Vibrant Wellness. There's also like Mosaic Diagnostics. When I originally did mycotoxin testing, it was Great Plains Laboratory was the company, but I think they've converted now, if I can remember. I think they converted to like Mosaic Diagnostics, but I still have my mycotoxin test in it. They really only tested for definitely like the biggest strains, but it was all over in red there that I had very high levels of ochratoxin and gliotoxin. And then the antibody testing is something called MyMycoLab. And it's a blood serum antibody testing for mycotoxin. It's going to test for 14 different mycotoxins for both IgG and IgE antibodies. But they say, Dr. Andrew Campbell is the one who kind of pioneered this, but he says it's the most accurate testing to see if you've ever been exposed to mycotoxins in general. So that one is a antibody, just a blood test basically that you can get done. There's small panels for like Candida, and this is a good question I get a lot when I do GI map or like stool testing, because that's one of the companies I use. My clients always kind of ask, well, does this test for mycotoxins? And I'm like, no, the gut test is going to test for like fungal overgrowth for Candida, but it's not going to show us mycotoxins. That's where you're going to get, like I said, you're going to have to do a little bit further specific testing to identify, because again, we did talk about there's a difference between like mycotoxins and Candida. I know organics acid testing can also detect yeast or fungal metabolites, but again, that's still just fungal. So the best ones for mycotoxin testing are definitely like a provoked urine test with a reputable company, and or this antibody testing.
So after you've had the testing and you start whatever the treatment is, whether it's, hey, this is something that we can do through breathing and, clearing lymphatic congestion, or this is something that we need to have some, pharmaceutical intervention, supplement intervention. How long does it typically take for people to begin feeling better after addressing mold sources?
Such a good question. I want to even list a couple of the expert guidance and resources that I provide for clients too. I tell them not to really get overwhelmed with this, but it's a tool and a resource. There are literally professionals who have spent their life's work dedicated to helping people recover from mycotoxins. I've definitely listened to a lot of different podcasts, and I've read different books actually, and I actually utilize in my own practice, I utilize different strategies from various practitioners, naturopathic medicine, MDs, and I'll kind of list those names here too, and we can put them in the show notes and stuff too, just so you can have access to it. But I know in particular, somebody that I aligned with, I felt like was a good time frame to know that you're moving forward and healing from this was, I had listened to a podcast from Dr. Andrew Campbell, and he said around 6 months, which I think is a reasonable time. But you should be making steps for sure, feeling better within like those 3 to 4 months, and that's how you know you're on the right path. And then, we can talk about those strategies. But it's not like, and it can take people sometimes longer, 6 months to a year sometimes, depending on how
how severe. I really think it's probably person dependent. Like it depends on like how severe. But like Kim said, like you should be seeing some kind of changes. Like the patient I was talking about, she's the first thing she notices, like, I feel like I'm getting clearer. Like my brain is kind of getting more on point.
Sure.
So it just depends on how severe I think the level of toxicity is.
Pre-existing conditions, anything like that.
Because you can have other overlapping chronic health conditions too.
Yes.
But yeah, and I mean the step process. I mean, in my own particular case, I felt like it was like a full on. For me, I felt like it was a full on year because I was really dealing with Candida overgrowth too, and mycotoxins. So it was like a whole, anti-Candida for like 3 months, and just then starting to do these strategies. Something that I've seen too in like the functional community a little bit is sometimes there can be a little bit more fear mongering around mold toxicity, and I just want people to understand like healing is really possible, and that you really just can take it one step at a time and focus on one thing at a time and just keep moving forward, and your body like is so capable of healing and recovering. And first and foremost is like get that lymphatic drainage going, get the detox pathways opened up. That begins with literally lymph, liver, and gut. Liver, and gut, and you just keep working those systems. Sweat in a sauna. First and foremost, reduce your exposure, right? Get out of the environment if it's causing harm. But then you open up those detox pathways with the lymph, liver, and gut. Then you can start to work on, depending on the certain types of strains, that's what's interesting. There are known and researched binders that bind up those mycotoxins, which those are, again, it's a supplement, a binder, that you can take that are going to bind up certain types of mycotoxins, depending on which one. So I had learned that too. So I was using particular binders, like before I would go into the sauna, like 15 minutes or so before I would go into the sauna, or there's different binders now that you don't necessarily always need to take, like fiber is a binder too. So like getting more fiber foods, like and the more bowel movements you have, you're going to release those toxins. But there are definitely there are mycotoxins that have affinity for certain types of binders, which is good. But big one is literally rebuilding gut integrity and rebalancing your microbiome too, because that's just the source of like absorption of everything. And your gut and brain connection. And then, most oftentimes, depending on how severe it is, people's immune systems are usually compromised and their mitochondria or their cellular health. So it's just going to take time. So it involves sweating, working on gut health, maybe taking some binders that help to start to eliminate these things. And it's a repetitive process. You just keep doing it. That's what I did. I was like, okay, I'm going to go in the sauna 3 to 4 times a week for sure when I first started this. And most people, if they're pretty sick, they're tired. So it's so hard for them to even do some things. So you have to go slow, and you have to, give them something that's manageable, not like, a protocol of like 20 things every day. Like that's important.
You mentioned some natural remedies. You mentioned sauna, you mentioned binders, and some of the other supplements. Is it possible for someone to recover fully just using foundational natural protocols versus going to pharmaceuticals?
Yeah, I mean, when you say pharmaceuticals, like there's definitely like functional medicine, like antifungals in general, because if someone has, I've seen some really great benefits from those when I was working at the compounding pharmacy. We used to make actually, because there was a couple of practitioners in the area that would regularly send us a prescription for like a combination antifungal nasal spray. Because in compounding pharmacy, it's great because literally like you can get that medication to the site of action fast. So like if someone has really bad brain fog, really bad congestion, really bad allergies, like doing that nasal spray is going to be so beneficial. And it was like a combination, I think, of like itraconazole, like quercetin, which is really good for like mast cell activation too. So it had like a combination of like 5 ingredients. I can't remember all of them off the top of my head, but I've heard a lot of clients say like, yes, I felt better using that for sure. So it can be a really good tool to help move.
To really help with those severe symptoms. Yes.
Yeah. And then just like, some people really, they need some strong like antihistamines and stuff. Sure. So it's, they're really good tools, I would say, for sure. And not everybody needs them.
Right.
Yeah. But to answer your question, I would say it's like, you don't always need all that stuff. I mean, there's home remedies, right? Like people do the neti pots and stuff like that. So.
That's what I always think about. Our audience is typically more gonna, sway more to the natural remedies versus going to interventions. Are there certain populations, I know we've talked about this, are there certain populations, kids, seniors, Lindsay, immune compromised individuals that are at greater risk for mold exposure?
Yeah, I think it's a bucket kind of thing. So if your bucket's already full of like you have you're already full of you're having other health related issues, just having that little exposure to mold toxicity is just going to pop you right over. Yep. So I think it really depends on obviously the severity of the mold toxicity, but where you are in your health can really tip you over the edge.
Yep.
Yeah, I would agree with that for sure. And yeah, I mean, the genetic factor, a little bit of it. Like I said, like there's some obviously like little kids or children who are born and they have eczema and they already have a low immune system, right? Or they're born with an autoimmune condition or something. Obviously, they're going to be more susceptible to faring poorer if they were exposed to something like mycotoxins.
Correct.
So it's hard to say for sure, but it's pretty much like where your body is in at that time. Because someone could eat a moldy food and literally just be totally fine. Because their body's healthy, they're strong, they have immune resistance to their gut microbiome and yeah, they'd be able to fight it off. And maybe they don't have MTHFR gene mutation like me or some of these other guys.
Yeah, for sure. All right. Any final thoughts, takeaways for people?
I think it's just kind of, like we talked about, if you're having some of these symptoms, trying to find the source and then working with professionals to help you develop a plan to help your body, recover and get some of this out of your system.
Yeah, I think for me, it's just like the encouragement to trust your symptoms and definitely seek root cause support if you feel like this might be going on for you. And it's definitely something that like I think in the conventional space, if you were to go in there and walk in their office and say, do you know anything about mold toxicity? I think I might have that. They'd probably look at you like you're kind of nuts. But yeah, you got to find some of these well-known experts here that have dedicated their whole lives to research and being able to support. But a couple of those people, I was like, I wanted to make sure we listed them too. I know I've said it a couple times, but Dr. Andrew Campbell was a doctor, a very well-known doctor in the functional medicine space. Her name is Dr. Jill Carnahan. She's a doctor and she has, they have really good resources and newsletters and free things on their websites and everything. And then when I first was learning, I had bought a book from Dr. Jill Krista. She's like a naturopath because, again, I wanted to kind of combine all those different strategies. Her book is called like Beat the Mold or something. And I like her book. It's a very nice, gentle way of like just allowing you to feel safe and know that your body can recover it. And she gives nice little steps in there. And I know she has like a whole community on her website and stuff like that where she's dedicated her life to helping. But those are some of the big names that I've seen that really can help people. Yeah.
If you are dealing with mold or suspect that it might be affecting your health, start by cleaning up your environment. Things like we talked about air filters, keeping the humidity low. It's summer now, so hopefully you can get out and get some sun. Supporting your gut with healthy foods, helping your body move toxins out, staying active, all of those things. And if symptoms are still lingering for you, that's when it might be time to explore testing or talking to a practitioner about more targeted support. So simple steps always can make a big difference. That's all we have today. We'll see you next time. If you've enjoyed this episode, please share it with a friend. If you haven't already, please subscribe, leave a comment. We are on Apple Podcasts, Spotify, or wherever you get your podcasts. See you next time.